Hi, everyone. Welcome. We're going to let people come in just a few minutes, and then we will have our interpreter make her announcements so that we can have everyone hearing the information in the language that they prefer. So as you come in, if you'd like to put your name and where you're from in the chat, please feel free to do that. We'll get started with our interpreter in just a minute or two.
Bienvenidos, vamos a dar unos cuantos minutos para que más personas nos acompañen. Mientras los que ya están aquí, por favor, si pueden poner de dónde nos acompañan en el chat, sería maravilloso. Hi, everybody. My name is Andrea. I'm here with the Community Language Cooperative. We're going to be practicing language justice today, and we're going to have simultaneous interpretation in English and in Spanish so that everybody can communicate, hear, and speak in the language of their heart. Once we turn on the interpretation, after I'm done saying this message in Spanish, you're going to see a globe that is going to come up at the bottom of your screen where you're going to be able to select your language. If you don't see the globe, go to the three little dots where it says more, and you'll find the interpretation function there. If you are not fully bilingual in English and in Spanish, please select your preferred language so that you can fully participate of this meeting. For our presenters, please remember that Spanish is 20 to 25% longer than English, so try to speak at a conversational pace so that I'm able to interpret everything accurately. Hola a todos, mi nombre es Andrea, estoy aquí con la Community Language Cooperative. Vamos a estar practicando la justicia del lenguaje el día de hoy y vamos a tener interpretación simultánea en inglés y en español para que todos podamos comunicarnos, hablar y escuchar en el idioma de nuestro corazón. Una vez que aprendamos la interpretación, ustedes van a ver un globo que va a aparecer en la parte inferior de su pantalla, donde van a poder seleccionar su idioma. Si no ven el globo, vayan a los tres punticos donde dice más y ahí encontrarán la función de interpretación. Host, we can start interpretation now and then give a couple of seconds and then I'm going to pass it to.
Thank you, Andrea. We appreciate you being here with us today. Welcome, one and all, to our seventh in the Whole Child, Whole Families, Whole Systems webinar series. We are here today to talk about family support sort of writ large. We're going to be talking about Birthkeepers and integrated intake programs, Help Me Grow, Going to Scale, all sorts of good things. And we're so glad that you're with us today. I'm going to let Ngozi introduce herself to you. She will be my co-host today.
Hello, everybody. I'm really glad that you're joining us. And yes, like Michelle said, this is our seventh webinar in our Whole Child, Whole Family, Whole Systems webinar series, 7 out of 9. So for those of you who are joining us again, welcome back. And for those of you who are joining us for the first time, welcome. We hope that the webinar is enriching, and we're really excited about today's topic. And we're digging into family support, as Michelle said, and we are really excited about our speakers and having you be a part of our conversation. So welcome, everybody.
Thanks, Ngozi. Next slide, please. So we want to talk a little bit about who's here. We've got over 400 people who registered, and they're from all over the country, 49 states. The District of Columbia and Peru is with us today, so welcome, welcome. And you are from just about all over the place, really. State agencies, community level agencies, early childhood and family coalitions and networks, child and family serving organizations, foundations and philanthropy, faith-based organizations. You'll see the list that is there in it, and we have a wide range of folks who are here with us today, and we're very glad you're here with us. As Ngozi and I have mentioned, we have been doing these webinars since February, and this is number 7 in our series, and we are so glad that you have joined us today. We wanted to talk just a little bit about all the other series all the other webinars we've done in the series, because we've talked about a wide range of cross systems building initiatives across the state and across the country and in community level. So we started off with just an overall webinar. That was our first one, introducing folks to the concept of whole child, whole family, whole systems. We were thrilled to have over 2,000 people registered for that webinar, so clearly there is a great interest in this topic. We moved to focus on specific segments of the early childhood arena, but always with a focus on cross systems, cross sector work, so that we were focusing on making sure that we were talking about systems that were actually talking to each other and working with each other. We've talked about economic supports, maternal and child health, homelessness, extreme heat, housing insecurity, and today, again, we're going to talk about family supports. And we're very excited that you're here today. Each of our webinars contain the voice of someone who's gone through a lived experience. We have national experts, and we have state and community examples in each of our webinars. We're thrilled that you're with us today, and I'm going to turn it over to Ngozi to talk a little bit more about the goals of the webinar series and the specific goals of our session today. Ngozi?
All right, thank you. And Jonathan, could you pull up our slides so that everyone can follow along? Perfect, thank you. So in this webinar series, throughout the 9 webinars, there are some themes that we've been covering. So we have been having a conversation with all of you about what does a whole system approach look like. We're really trying to dismantle systems that are siloed and that don't serve families very well. We're thinking about what are those key challenges that we need to be thinking about. We know that you all come from different aspects of the prenatal to 3 space, and you therefore have different ways in which you can help improve the system. So we're thinking together about what are the key challenges, what should a whole system approach look like, what are strategies for systems integration, how do we center family voices and do it in a way that really elevates equity. And as Michelle had pointed out, we have been featuring family members with lived experience to really help us see what we are working on in a very real way, rather than in an abstract way. We've been thinking about how we leverage leadership and leadership at all levels. Everyone on this call is a leader, and so we've been thinking about how do we elevate all of the ways in which you all as leaders present in your various spaces, and how do we use data to really inform the decisions that we are making. We've been looking at real world examples. We have been inviting members from communities and states just to help us see what's possible and to help us look at some really exciting innovations and think about ways that we can act in real ways that are beyond textbook strategies, and thinking about ways that we can not only try out some new innovations, but to sustain those efforts that are working and working well. So these are all the things that we have been trying to accomplish as we've been having these conversations with you all over this past year. Next slide, please. So for today's conversation, we are focusing on family support. And as Michelle and I both mentioned, we are really excited about this topic because we think it's an opportunity to really unpack the concept of family support. It can feel really nebulous and really abstract at times. I mean, if we were talking about pediatric dentistry, everyone would know exactly what we're talking about. It would be super clear. With family support, that it can be many things. And so today we are going to be looking at what that means. We'll be defining it, and then we will be looking at some examples of the different ways in which family support families. So today we're going to be thinking about family support in the frame of whole child, whole family. We are going to be thinking about the impacts of federal policy on children and families, and we are going to be looking at the opportunity. So we'll be looking at the negative impacts that can harm families, and then the opportunities that can support families. We are going to be using the block, bridge, and build framework. So we are going to we'll unpack that a little bit more. We're going to be looking at how lived experience can really drive the design of more responsive, ways to support families and think about how a parent-led support model can build trust and connection with families, and how to center parent voice. We'll also be thinking about the cultural, emotional, and practical roles that aunties play in Indigenous communities, and how the Hummingbird Indigenous Family Services integrates this into their programs and support systems. We're really excited about that part of the conversation. And we are going to be looking at Help Me Grow North Texas's approach to making sure that families are connected. And they're going to be talking about their navigation approach to connecting families beyond just referrals, like really connecting families in a way that gets them to what they need. Next slide, please. And now I'm really excited to introduce our really lovely panel of speakers. So we really, if we don't take anything else away from this webinar, we really want to invite this entire group to think about how we move beyond checklists and referrals and move into a deeper conversation about what it truly means to support families. So we will hear from system builders, practitioners, parents who are reimagining family support through lived experience, collaboration, and community-rooted care. So we're going to begin with Karen Howard. Karen Howard is the founding partner of Crossover Partners, LLC. Karen is a nationally recognized leader in early childhood policy with decades of experience advancing equity for children and families. So she brings a deep understanding of what it takes to build systems that are not just evidence-based, but justice-informed. And then next, we'll hear from Helena Gerard. She is the founder of Periscope of Hope, LLC. Helena is a maternal health and substance use advocate who brings the power of lived experience and data storytelling into every space she enters. And as a fellow with the Policy Center for Maternal Mental Health and the National Collaborative for Infants and Toddlers, she's reshaping conversations about trauma, healing, and hope. And her work reminds us that family resilience is not just a statistic, it's a call to build better systems. We're also honored to welcome Cami Goldhammer. Cami is a citizen of the Sisseton Wahepton Oyate tribe. Cami is a nationally recognized leader in Indigenous birth and breastfeeding equity, and the founder of Hummingbird Indigenous Family Services. So her work centers joy, reclamation, and community. So she's training hundreds of Indigenous lactation counselors across Turtle Island and restoring first food traditions interrupted by colonization. So Cami challenges us to build systems that repair harm and restore cultural strength. And then finally, we're joined by Leanna Wydick and Miranda Holmes from Help Me Grow North Texas. And Leanna brings years of experience in leading early childhood systems and building partnerships that elevate community voice. And her work is rooted in the belief that change happens when we invest in people and relationships. So Miranda, a longtime early intervention leader, now serves as System Director of Scale and Spread, sharing innovations across communities. And she's a systems thinker with a heart for continuous improvement and a clear vision that every child deserves the chance to thrive and every family deserves to be met with care and respect. So together, these remarkable leaders remind us that families don't fit into boxes, and neither should the systems that serve them. So let's go ahead and get started. I'm going to turn it over to Karen.
And Ngozi, thank you so much. I want to thank Build first, really shining a light on family support in the context of whole child, whole family, and whole community. I'm also so glad to be here with such an esteemed panel. I really can't wait to hear from them as well. But want to jump in and say family support is really the backbone of a whole child, whole family system. And why do I say that? Well, we know, and from the past webinars, we all have heard, right, that children grow up and develop in the context of their families, in the context of their communities, and in the histories that those communities and families have. And of course, we don't look at children and say that's my child's health versus education versus housing. They need all of those supports. And so family support systems are really the navigator and glue that glues into what is really tailored to the needs of families, when they need those supports and how they need those supports. So they are a broad set. And I think Ngozi mentioned and Michelle mentioned, it's hard to get your arms around it because life is hard to get your arms around it. And families live in the context of communities, histories, and what we're going through. So they're a broad set of services focused on supporting families. They provide supportive environments, parental and family engagement and education as a family unit when the families need it. They promote healthy family relationships. They really promote access to needed services. So healthcare, nutrition, economic supports, housing, um, a number of different supports. And that is all about what family support is. Next slide, please. I wanted to give you an idea of a couple different core components of family support programs. Family resource centers are one of those core components. They came about in the late, I think, 1980s. They were really initially, I think, meant to prevent child abuse and neglect, really neglect, because as we know, much of child abuse is actually neglect and the inability to provide for families because families and parents go through so much. But family resource centers, they're called many different things. Here in the Washington, D.C. area where I am, they're called family success centers. They can be in a school system, they can be in a community. Here in DC and in other places, the community determines where they are and the set of services that they offer. They often hire folks from the community and they have peer counseling, case management, immediate crisis support for intimate partner violence, domestic violence, after school activities, literacy programs, workforce training, home visiting, early intervention, a whole constellation of supports that families need. And they're tailored to what families need and when they need them. Other family support, and I think you know this, is childcare respite care. So temporary support for parents who need respite care, who need to have their children there so that they can take care of emergencies. Health and wellness programs, youth programs, fatherhood programs, you name it. Family support really encompasses all of that. I listed out here also paid family leave and cash assistance programs because that's all an outgrowth of family support. And those are policies that a number of advocates are waging nationally. I should also say family support programs and family resource centers also advocate on behalf of families at the individual level to get families what they need and to navigate really complex systems that are not built to really serve families in the way they need to be served, that are not equitable, that are not culturally affirming. And so family resource centers and family support is meant to encompass all of that. They also advocate on a national level for what families need. So when you think of they're providing direct services and they're providing coordination and referrals, but they're also part of the apparatus that is advocating on behalf of children and families. Next slide, please. I think I don't have to sugarcoat this. I think you all know it. Right now, families are under attack. Family systems and the systems you work in are under attack. It started with this administration and the anti-DEI. We know that 50% of the children in this in this country, and in some states it's even greater, are children of color, are immigrant children. are children living in poverty. And so attacks on that really are meant to undermine the levers of society, these systems that have been built up, and supports for children and families. I won't go through all of the different things in which there have been attacks, but I will say that in the recently passed One Big Beautiful Bill, it's hard to say that because this bill is so damaging and wages war on families and children and changes the trajectory of the nation. So the One Big Beautiful Bill, I'll just call it the Reconciliation Bill, extends the tax credits that were in the Trump era from his first term. It at a cost of $4 trillion over 10 years, it blows out the fiscal budget, the deficit by 4.2 trillion. And it significantly reduces the tax base, the money that comes into the government to fund all of the services that we know children and families need. So not only does it blow out the deficit, but the money coming in will be considerably less than in past years. And we know investments in children, I think the federal budget only invests about 8%. The bill is the cost of this bill will be borne by wage earners in the fifth lowest quintile, I should say. So who pays for this? Poor families pay for this bill. And 12 to 16 million Americans will lose their health insurance over 10 years. States will suffer as well. We'll get into that in the next slide. So the bill, we know that Medicaid, how important Medicaid is. It covers 83 million people, including 32 million children. It finances 40% of the births in this nation, and it plays a vital role in our healthcare system. This bill cuts Medicaid by 850 million. It imposes work requirements on adults who are 18 to 64. Mostly these are the adults, the low income adults working, who are already working, who are childcare workers, who are adults of the families, the children that you serve in your communities. Those are the people. So it may not impact the actual children, it certainly impacts their adults. And as we're looking at family support systems, you know that children live in families and adults must be secure and have health care as well. It does that by frequent eligibility checks. And we already know about 90% of those on Medicaid are already working. And it undermines maternal and child health. It puts children in rural communities in a particularly bad position because hospitals will suffer and likely close. On the other side of it, it also impacts the Supplemental Nutrition Assistance Program. This is our country's #1 program to fight child hunger. It cuts SNAP by 300 billion. It imposes cost sharing on states that didn't occur before. So states will have to come out of their budget to pay for SNAP. It requires, again, frequent eligibility checks, and it reduces the actual SNAP benefit, which was already very lean. You see here is $187 per month on average. Everyone knows with inflation what food costs. It jeopardizes nutrition for 14 million children. And most of the children are duly enrolled in Medicaid and SNAP, and so you see the reciprocal harm that occurs. Next slide. Just some of the other really hallmarks of this war on children. The child tax credit, which we all wanted to see expanded, was expanded, but not for immigrant children or families living, children living in immigrant families who are themselves citizens will not get this tax credit. So that leaves 4.5 million children without this benefit. The law also has just $70 billion over 4 years for immigration enforcement. And we know what that means. It means tearing families apart. It means having detention centers. It means having ICE agents work with the FBI and local enforcement. It means really terrorizing immigrant communities and other communities too that are caught within or ensnared within that. There is the public charge rule as well that just came out a couple of weeks ago, which mandates that Head Start programs, schools, other programs are to verify eligibility and citizenship status. They never had to do that before. Everyone thinks it's against the law, but this administration has done things that are against the law. And so that is playing out. And it again is an attack on immigrant families and communities. We can talk all day about birthright citizenship. In the Constitution, it guarantees citizenship to all children who were born here. But I think we've seen that's been caught up in the courts, but it is something that this administration is also wanting to move on. That would have draconian impacts on states as they try to verify who is a citizen and who is not a citizen. And of course, there's a withdrawal of funds for English language learners, for vaccines. There's rescission in Congress, where Congress will appropriate money and the administration will claw it back and weaponize funding. And so all of that is occurring right now. And I know all of you see that because you're right in the midst of it. Next slide. Okay. So the young child on the left, that is often how I feel. This is the politics of chaos. It is relentless attacks on children and families. And it can feel in many ways very paralyzing because when so much is happening all at once, it's hard to know where to land. But it's important to really remember in the midst of chaos, there's always, always opportunity. There will always be chances to mitigate harm, to set children and families up, and to resist that type of policies. Next slide. So I just want to briefly mention this Block Bridge Build is a framework coming out of the Othering and Belonging Institute with John Powell. I found it really useful to think in this way as an advocate, that what are the ways in which we can block threats that we face? What's the immediate things that we can do? How can we advocate? How can we protect immigrant families on the ground? What can we do with litigation? What can we do to protect against Head Start being closed down? So thinking about there is a group that are working on blocking harm. And I think that there's a group at the national level. I think folks are mobilizing. Many of you in your own work are blocking harm. There is a group that is bridging across different sectors, across people, maybe in districts. I'm a policy person, so I think in political terms. I think about those swing districts. I think even about those communities, largely in rural areas and in red states that voted for this administration, but did not vote for any of this and the harm. What are the ways in which we can bridge? For you, what are the ways in which you could bridge within your systems, within your state, cross-sector? What are the ways that you can bring together people that really want to invest in children, want to protect children, and want a system for children that is whole child, whole family? And then finally, how do we build for the future that we want? I will say I would love it if there was a project child 2027, 2028 that's galvanizing and that the field can come together on. But what are the ways in which we can build back? And I hate to say build back better because it was an actual bill, but what are the ways? Many of these systems were not equitable before. And so if these systems are torn down, what are the ways we can build it back? And so I will stop there. Look forward to hearing the other panelists in the discussion.
Thank you so much, Karen. And thank you for grounding us in the bigger picture and reminding us what's possible when systems are designed with equity and dignity in the center. And I really love that image that you had at the end of the bridge, because I think it really captures what we're doing here. We have people on this in this discussion from different sectors that serve in some way, shape, or form the prenatal to three space. So we have policymakers, advocates, folks that work in intermediary organizations, first folks that are on the ground working directly with children and families, serving them on a daily basis. We have folks who are in the philanthropy space and fund organizations and initiatives that can help advance the kind of policies that we want. So thank you for bringing us together, and thank you for helping us see the bigger picture. And so now we're going to shift into a more personal conversation. I'm honored to welcome Helena Gerard, who is a parent and advocate and founder of Periscope of Hope. So Helena has generously agreed to join me in a live interview to share her family's journey and to help us think differently about what meaningful support can look like. So Helena, thank you for being here. There we go. Now I can see you really well. Welcome. So let's get started. I'm going to go ahead and just launch my first question to you.
All
So,
right.
Helena, your journey into advocacy is deeply rooted in your own lived experience. So I'm wondering if you can share a little bit with our audience today about your journey.
Absolutely. I am honored to be here. Thank you so much. This is so great. And if I look up, I have a little bit of notes to keep myself on track, but I am, just like at the beginning of the presentation, going to go with what's in my heart. So all of you being here, thank you, because you are the reason that I get to be here. So gosh, I feel like my journey really started when I had somebody see me, and I felt respected and I felt that they could see me. I was in 2013, I was using opiates. I was sexually assaulted, and from that I became pregnant. And when I went to the hospital after that, the doctor looked at me and he said, "Well, that's what you get when you mix drugs and alcohol." And I was like, "Oh, you're right. That is what I get." So I was not in a big hurry to get prenatal care because I didn't want another doctor to say the same thing. I was terrified. I was still using, and I just didn't know what to do. And I finally went, moment like that I'll never ever forget, going to the health department, and my OBGYN just sat with me, and she sat. So we were, equal. Like, she sat on her stool, I was in my paper gown. She didn't type. She asked me about school. She just had a conversation with me like I was a human. And she was like, "Oh, we'll get through this. And I think you have potential. You're going to be a great mom." And I was like, "This lady is absolutely crazy." Like, I just told her I'm using IV drugs, I'm pregnant, and I've had no prenatal care, and that I needed to stop using drugs, and I didn't want to use methadone, and basically gave her no choice but to titrate me off of opiates under hospital care. Back then, it was not recommended at all by ACOG. Now it's safe to do during pregnancy, or during pregnancy, during the second trimester, but then it was definitely not recommended at all during pregnancy. And I was adamant that I stop using. And so she believed in me enough to meet me at the hospital. And I didn't even show up the first time. She said, "Meet me at the hospital tomorrow morning at 9." And I didn't even show up. By the time morning came, I was so scared, I didn't go. But I did go back to the health department, and she did come in with no judgment and sit down with me and say, "How are you?" In that moment, I was like, I need help. Like that was my moment. And I just remember crying and saying, whatever you need me to do, I'm willing to do it now. And she met me at the hospital the next morning. And, she was the first person that was nice to me in over 10 years easily. To say I had potential, I was just, it really blew me away. And when I was in the hospital detoxing, the nurses could have been horrible to me because they knew what was happening. That I had been using until 32 weeks of pregnant and was just now getting care. And instead they helped me find safe ways to breastfeed my daughter with hepatitis and resources. And they they helped me transition into going to inpatient treatment where I was with my daughter. And Ngozi, stop me if I just keep talking. Okay.
No, please. I've asked you about your journey, and I'm really glad that you're sharing it. Please share as much as you'd like.
Okay, just jump in and ask questions if I, anything. So they helped me connect with inpatient treatment. So I was able to go to an inpatient facility that specifically for pregnant and postpartum women. You can have your children up to 5 years old there. They have a child care facility on site so that women can really focus on recovering. And so I went there. My daughter was born at 38 and a half weeks. She was healthy and beautiful and perfect. We spent 6 days in the hospital because I had drop foot and had to have an emergency C-section and a spinal patch and all these really fun things that I don't like to tell new moms that could happen while they're pregnant. I'm like, so I'm glad that I didn't know about them. But so while I was in the hospital, I was able to stay with my daughter and we were able to go back to treatment. And I realized that if I was going to do anything with my life, as a productive member of society, that I was going to have to be honest and admit that I had warrants in multiple counties. My mom came and picked up my daughter when she was 2 weeks old. And I turned myself in. I was gone for I was in 3 different counties for 72 days. But while I was in jail, one of the things that got me through it, I don't ever have really an opinion when I talk about postpartum depression either way when people ask if I experienced it, because I was in jail, so I was miserable. And I was feeling all the things. I was facing 5 years. I didn't know what was going to happen. I had no idea. And while I had letters from judges and counselors and my OBGYN and other doctors to support me, my probation officer was not a fan, and he did not he recommended the 5 years. And so I knew that. But in that time, I got to sit with the nurses while everyone went to eat every day, 3 times a day, which it's not enough, but it was good enough for me. 3 times a day, I would go sit with the nurses and I would pump my milk. And I couldn't send it home to my daughter because they didn't have a biohazard refrigerator. So I had to dump it. Every time I pumped, I dumped, but they let me have pictures of my daughter in the nurses station, and they would help me, just anything that we could think of to stimulate milk production so that I could still breastfeed when I got out. Because I believed that I was not going, that it was, I did not believe I was going to go away for 5 years. And the nurses found me once I went back to treatment, to let me know that the sergeant, who I had never met, heard what I was doing and advocated and got a biohazard refrigerator for mommies to send milk home to their babies if they're incarcerated and producing milk. So I thought that was really cool because I didn't know I was an advocate for anything. I finished treatment. So I ended up being sentenced back to treatment. I spent 6 months there. I also once I was there, I was gone for a total of 11 months. I went to a shelter for families, and we were actually there for 14 months. Most people stay for about 6. But because of my background, I had a harder time finding places. I had apartments tell me, even though I had the money, I had the jobs, I had a couple years in recovery, they would say, oh no, we're trying to clean this place up. We don't rent to people like you anymore. Like, they would tell me to go live in other neighborhoods. They would show me a nice place in a safe neighborhood and look at my background and say, oh, we think you'd be a better fit over here in this neighborhood. And so it took me a really long time to find a safe place for us. While I was there, I had time. I worked 2 jobs. I went back to school. I had gone from being the class president and 8th in my class to having a 1.6 GPA to them asking me not to return to school at all. So I had to do, I learned how to appeal academic dismissals. My loans were in default. I was able to repair those. I was able to graduate with my associates in arts and then my associates in science with a specialization in addictions. And while I was doing that, the services that I was receiving, childcare subsidies, the organization that I lived at, Family Renew, that the organization that was the shelter, Healthy Start, of Flagler and Volusia counties. I like to say specifically in Florida, Healthy Start is different than the Healthy Start that's recognized nationwide. So I like to clarify that just because we work so closely with Healthy Start still. But all of these places would ask me to come and speak at events. So that was kind of how I got thrown into the prenatal to 3 world, even though I was already in it. I was living it. I was in prenatal to 3. So I would go to these and speak. And so any way I could give back, that's what I would do. And I was sitting at my daughter's swimming lessons one day, and my friends called and said, we're writing a grant to the Pritzker Children's Initiative for a fellowship. And we want to use your lived experience because we think that you'll make a great story and you'll do some really great work. And I knew that they were looking for PhD candidates or people who already had their PhD, and I was still working on my bachelor's. I didn't think I had a shot. And I got it. And so I got to do a fellowship for Pritzker from 2018 to 2020. I got to travel all over the country with my sister fellows. We still talk. We still coordinate. We still have, every 6 months we'll get together on a Zoom call because we're in California, New York, but we still stay together as a tribe. They helped me. My brother was in a plane crash, and they're on the other side of the country and carrying me through something because they know that we don't go through anything alone and get through it okay. My capstone for the fellowship was on relationship building. There was nothing that I could think of more that I wanted to talk about than the importance of relationship building, because that's how I got through everything. And today, that same OBGYN that believed in me, she and I have she's the owner, but we have together, I'm her practice administrator, a prenatal and postpartum clinic for nonprofit called Baby Steps. And we take women who are uninsured, underinsured. We have a sonographer. We're waiting for certification, but when we get it, we will we'll be able to do labs in-house. We've only been seeing patients since April, so we're still learning. We've expanded to telehealth because some of our patients weren't able to get to our site. And we are actually in the same building as our WIC office. I'm sorry. Can you hear me okay? Okay.
Yes.
Okay. As our WIC office, so we can do that warm handoff. Something that we are very, very intentional about is referrals and with those relationships. If somebody doesn't answer our calls, one of us will drive over there and see why they're not answering. And you know, we have some grumpy people who have some compassion fatigue that are those gatekeepers. And when we come in there and we're smiling and happy and we want to help these mommies, and you know, they come around and they're like, oh, my name's Mindy or Becky or whatever it is, and ask for me next time. Just even our extended stay, we have an extended stay here that has given us a pretty significant discount because we pay for our moms who don't have a place to go until we can find them a more permanent solution. We will pay for them to stay in a hotel. We work with another organization that will bring them food. And because it's an extended stay, they have kitchenettes. And so they bring them food that they can cook, they can eat. And, you know, when I meet those moms over at the hotel, I very specifically, it was very intentional that I didn't put the card in so that we don't have to go over there. They're like, oh, you don't have to come over here every time, but I want to. I want to see them. I want to hug them. I want to be able to look at a mom like I did last time and know that that one duffel bag is the only thing that she has, because that was me. I had a duffel bag. Hers was a little bigger and nicer than mine. I was a little jealous, but she had that, and I knew immediately she didn't have food in there. And so it was 4:30. I knew that there wasn't anybody that was going to be answering any phones in our social services world to bring out food. So we made sure that we got her food. So she had dinner. We got her a case of water, and we're able to have somebody immediately in the morning bring her out food so that she could have breakfast. And the hotel they also provide breakfast for them as well. So I knew that she'd have breakfast at least until the organization could get there to help. But we definitely, you know, we're a little bit different model. We incorporate a lot of midwifery modeling, and just believe that every mommy deserves to have the dignity and hope that I got. And you know, if someone in our practice doesn't have that culture instilled in them, they don't stay. We don't wait to see if they make a patient mad. We don't wait to see if they don't do the right thing, because it's a culture, we can feel it. And we want people to be able to walk up to the window and we say, we can't see you today, but we can get you in for a telehealth visit, or we can see you tomorrow, or let's get you to fill out all the paperwork right now so we can have everything ready so we can get you in as soon as possible. I think I went way off my notes. I haven't even looked up at them.
Elena, actually, you have answered. I've taken all my notes here and I've just kind of like thrown them because you have answered all of the questions I wanted to ask you. And I feel like you have, first of all, you are incredibly brave, sister, for just sharing such intimate parts of your journey with us. And I want to thank you for that. I think we've learned so much about how to be a trailblazer, because that's what you've explained for us, your journey. I just want to just lock into a couple of things that you said, just so that those of us who are in the audience don't miss it. I feel like when you talked about what your journey has been, there have been two categories of people that you have interfaced with. So there are the people who believed in you. And so on that side, you have people who believed in dignity, who believed in hope, comfort. They offered those kinds of things to you. And they offered you opportunities because that's what they believed in. And that's what allowed you to move to the next level in your journey. And then you also had people who, I like your phrase of compassion fatigue, so they showed that, or perhaps they showed judgment. And so I feel like you have painted a picture of what family support looks like when we are approaching it from either side. And I think the caution here is that we want to be on the other side. We want to be on the side where we're offering families hope and support, regardless of how you fit into this prenatal to 3 space. So I want to say thank you. Thank you so much for sharing your story with us. And my hope is that those who are listening remember your story when they're working with families. And I want to say one more thing. When we had our pre-interview, I remember you said that when families are coming to an agency or an organization for support, it's not the first place they're turning to. This is often the last place. They've exhausted support from families. They've exhausted support for friends. They're not there because they want to be there. And so I think the caution is that when families need services and support, that we bear that in mind, that they're not there to take advantage of the system. They're there because it truly is their last resort. So thank you for all of your wisdom and just for being here. Thank you.
Thank you for having me. It's always a pleasure. And I know that it's not question and answer time now, but like, I always encourage everyone, if they have questions and they want to ask, or they have that, that bad feeling, like, why, how could you? And they just can't. If I feel like over the years, my skin's gotten a little bit thicker. So if anybody has any questions like that at the end, I'm always happy to give my personal perspective. I don't represent everyone in recovery or with a substance use disorder, but I can represent myself.
Thank you. And I just want to say again, I am proud of you for all your progress. All right. Well, thank you, Helena. And now we are going to pivot to the next part of our conversation. I'd love to turn it over to Cami Goldhammer.
Okay. Hopefully everyone can hear me and see me okay. On Petiwashte Mitakiapi, Cami Goldhammer, Amakiapi, Damakota Winya, Sisituan Wapetuan, Hamacha. So good day, relatives. My name's Cami Goldhammer. I'm a Dakota woman and I use she, her pronouns. And I am Sisseton Oyate, and I'm actually coming to you from my homelands today. I am teaching an Indigenous lactation counselor training here on the Lake Traverse Indian Reservation, which is where I'm from. But I was born or grew up in and raised in Seattle's urban Native community in Washington State. So really, really grateful to be here with you all. And have an opportunity to take a break from teaching and leave the class in the hands of my co-teacher, Kimberly Morsalis, who's a Navajo lactation consultant. I know I don't have a ton of time with you all to talk about the work that we're doing at Hummingbird Indigenous Family Services in Seattle, but I'm really, looking forward to giving you a brief overview of what we're doing. I typically, before I start out talking about Hummingbird, I always want to, kind of share a little bit about my own experience. I am a licensed clinical social worker, a full spectrum Indigenous doula, and an IBCLC, or internationally board certified lactation consultant. And I've spent the last 20 years serving Native moms and their families in the Seattle area. I myself am a Native mom, and I also think that probably my most relevant experience is being a Native child and having parents that really deserved and would have benefited from something like Hummingbird Indigenous Family Services when I was a kid growing up. So I always describe Hummingbird as a love letter to my parents, my grandparents, and the support system that they certainly should have had as Native parents. So Hummingbird Indigenous Family Services is a Seattle-based nonprofit. Our mission is healthy Indigenous babies born into healthy Indigenous families, supported by healthy Indigenous communities. We serve the urban, Native American, Alaska Native, Kanaka Maoli or Native Hawaiian, and Pacific Islander community. And we believe that the best thing for Native children is to love and care for their Native parents that gave birth to them. So we are an organization that is all about mamas, birthing people, and caring for those that are giving birth to Native children. And we do that through a variety of ways. Again, we serve a really diverse urban community. In Washington State, we have 29 federally recognized tribes. But in the Seattle area, we have over 300 tribal communities represented and dozens of Pacific Islander communities represented. And that's because of a series of federal government policies that moved Native people to urban areas, and of course our close connection and shared waterway, the Pacific Ocean, which has allowed our Pacific Islander and Kanaka Maoli relatives to find their way on the mainland as well. So we're, again, like serving a lot of different people in a lot of different ways. 100% of the staff at Hummingbird would qualify for services at Hummingbird. So we are all Indigenous and all are from one of those 4 communities that I named earlier. So we do have, we are completely community-based and community designed. We were founded in August of 2021. So this is our birthday month. August is a big celebration month for us. And in 2 weeks, we're going to be celebrating our family reunion, where families come and if they've ever been served by Hummingbird, and we barbecue and hang out and line dance and do all the things. But yeah, 4 years ago, and we started out as a doula organization. So it was myself and 3 doulas, and we started Hummingbird, and today we have 31 employees. We're hiring 3 more positions right now, and we now have 7 programs. So we have grown a lot in just 4 years, and I think it really speaks to 2 things. One is this incredible staff that we have. It's a really special team, and I know lots of people feel that way about their workplaces. And I really love the people we work with, and they're so committed to the community and just do an incredible job. And so we've become a very trusted resource in the community very quickly. I have a pretty high bar for the Native community. I always say, we deserve nothing but excellence, and anything less than that isn't good enough for me. And so that's kind of how things are done at Hummingbird, generally speaking. And then the second thing that I think has really helped us grow is it really speaks to the need. And that there really are very few programs in the United States and Canada that specifically serve Native moms and their families. We have a lot of organizations that serve families, right? Or they might have some family programming, but we are a pretty hardcore prenatal to 3 organization, and that's what we focus on. We can go to the next slide. And then you can kind of just briefly show it, and then you can go ahead and skip to the next one. But these are our values as well. So really just, we are a community designed, community centered organization. All of our programs are 100% designed by us with the explicit involvement from our community to tell us what they needed and what they wanted. So we can jump to the next slide and we'll stay here for a while. So I'm just going to do a very brief overview of our programming because I think I only have 10 minutes and probably at least 5 minutes in already. And I'm actually going to kind of start from the bottom here, which is with our indirect service program. So Hummingbird is made up of direct service and indirect service programs. For me, Hummingbird started out as a doula org. At our core, we're a doula org. Many of us are doulas. I myself am a total direct service worker, and so I still serve families. I still go to births. I still do lactation visits, things like that as they're needed. Obviously not as much because I also have to run the show, but it's really important to me to stay similar to what Helena was talking about, to stay on the ground. And it really helps to, to be grounded in our work, to remember why we're doing it, to understand the varied environments that our families are living in. And then I think for me as an employer now and someone that's like hiring people and wanting to keep people working, it really helps me to remember what it's like to be the one doing the direct service and how can I make things easier for my staff. So there's a lot of reasons why I do it, but I love it. Again, I love it. Love direct service, but our indirect services we have a policy program. We have a policy fellow with Pathways, which is an early childhood policy fellowship. And our fellow is with us. She just is actually finishing up her first year of a 20-month fellowship. And then we also receive funding to hire her for 3 years after the fellowship. So we're really excited about that. And that was just because I really lack capacity, and there's so many different areas that we've been wanting to be more involved in the policies and legislations that are affecting our families, but just really struggled with capacity and an ability to do that. I can't keep up with all the different legislations that are being voted on. I can't constantly be testifying at the legislature, things like that. And so having our policy auntie is a really important piece of this. We also have our data sovereignty and storytelling program. We're, really, really believe in our right as Native people to tell our own stories, and really have self-determine and sovereignty over our data and the information. And so we do in-house evaluation. We have our data sovereignty program. We're currently evaluating have three different evaluation projects where it's Native evaluators who are looking at our community designed programming and really looking at the things that matter to us. So we're super excited about that. Our storytelling program is really about narrative change. So we have artist residencies where different Indigenous artists come in and spend time with our families to tell their stories in traditional ways through artwork, song, dance, and so on. So it's really awesome. We're in the middle of our second residency right now, and we're also doing a documentary on our guaranteed basic income program, which will be out in a couple years. But I also want to just kind of spend the last part of my few minutes I have with you talking about our direct service programming. So again, I'm kind of like moving up, but we have the Fireweed Connection is our culture and community engagement program. We believe that culture is prevention, and we believe that the grief, the unresolved grief that a lot of Native people carry is a result of our culture being literally stolen from us. And kind of the harms that has left. And so our Fireweed Connection program we put on so many different culture classes. Our kind of like signature culture classes are our birth bundle package, our birth bundle series, where each month for 6 months, so it repeats twice a year, families are making something in preparation for the birth of their baby. So they'll make a cradle board, they'll make a belly button pouch, they'll make moccasins, they'll make a baby rattle. I teach the star quilt class, so they make a quilt and, you know, a star quilt for their baby. And a person can join, you know, enter that at any point in their pregnancy because they're just repeating it twice a year. So that's, you know, one of the things that we do with that class. We find that a lot of people, when they become pregnant, really what they want to do is pass on something to their baby, and often that's where they really desire more connection to culture and teachings. And so that's what we're doing there. Pila Makua Family Connections is one of the programs of Pila Makua is a department. We have home visiting, which is what it started out as. And our home visiting program really came out of a need of our doula program. So thinking of it as the doula program as the foundational program. And kind of what we got into is people wouldn't leave the doula program. So they, you know, they would, we'd work with them, and then they wouldn't leave, but we'd have more people coming, you know, like having babies. And that was a challenge. And so I was like, we need to have another option or somewhere to go. And so that's where we started the home visiting program. Our home visiting program we use a community design curriculum that we've created ourselves, which is the Hummingbird curriculum, and that's one of our evaluation projects. And it's for our families that are at highest risk for maternal mortality and or child welfare involvement. So postpartum those that are at highest risk for maternal mortality or dying is going to be overdose and suicide. So our mamas that are experiencing you know, pretty severe perinatal mood disorders and or are newly sober or struggling with substance use disorder, those would be moms that we would refer on to home visiting. And then if we have families that are at high risk for child welfare involvement or are involved with child welfare already, would go to home visiting, because ultimately we believe that Native children belong with their Native parents, and that the family needs to stay together. So home visiting does that. We also have more culture classes, new parent support groups. We have a peer counselor, a perinatal mood disorder peer counselor. So a mom who herself experienced the perinatal mood disorders when she had her children, and she works with our family mamas that are experiencing the same as in a peer role, which is really special. And then we have our Birthkeeper program, and then I'll talk about the nest last. So our Birthkeeper program is our doula program. All of the programs, because I know I talked about aunties and kind of what you all would learn in this, but really what we, you know, when we talk about our roles as doulas, and in my language, Dakota, which is what I spoke to you when I first got on, our word for doula or midwife is tuween, which is our same word for auntie. What we know about our communities traditionally is that it was the aunties that took care of people when they had babies, when they started new families. Traditionally, the only role of a Native parent was and is to love their child. And it was the aunties, the uncles, the community that did the minding, that supported them during that process, that took care of them during the postpartum ceremony. So our work as doulas or birth keepers is really fulfilling that traditional role of an auntie. And what I hope is giving a parent, even if it's like a 4-hour visit postpartum, they get this opportunity. They get this opportunity to just love their child when the doula is there, right? Like the doula is taking care of everything else around the house. Our Birthkeeper program is a full spectrum doula program, meaning we do serve people regardless of the outcome of their pregnancy. We are a pro-abortion organization and a reproductive organization, and an overwhelming majority of people come to us because they're pregnant and wanting to parent. But we do have an out-of-state abortion fund, particularly in the states surrounding Washington state with high Native populations, where their right to abortion has been consistently reduced. And so people can call us and we will pay for them to come to Washington state. We'll provide transportation, whatever they need to exercise their right to end their pregnancy if that's what they want. And then last but not least is our nest, and then I will pass it on to the next person. But the nest is our guaranteed basic income program. You know, all of our programming at Hummingbird is really, really important. But in the end, you know, we really couldn't solve the systemic issues of poverty, right? Like, we could do our best. We could provide a lot of social, emotional, spiritual supports to families, but that only goes so much when a family doesn't have food, when a family doesn't have stable housing, when a family doesn't have transportation to get to work. I mean, we can go on, and I know you all know the impacts of poverty on our communities. And so the guaranteed income program was an opportunity to maybe address that, right? And give people, give moms a little bit more to get ahead. So the NEST program is, again, our guaranteed basic income program. We have 150 moms that are in the NEST. It is closed. It is a pilot. So we are just running the 150 moms. They all entered in at some point in pregnancy after 12 weeks, and they get $1,250 a month, no strings attached cash, until their child's 3rd birthday. So that's about $45,000 a year plus whatever they got in their pregnancy. So a little bit more. And then when their kiddo turns 3, we'll be opening a $5,000 529 college savings account for that child as our investment into that 2nd generation. We are about 2 years into the NEST for the earliest cohort. So we started enrolling people in August of 2023. And we enrolled 15 moms a month for 10 months. So that first cohort is those kids are 2 or about to turn 2. And then our youngest cohort, which was May of 2024, their kiddos are about 1.5. So we still have a little over 1.5 years of the NEST. Again, that's one of our programs that we're evaluating as well in the data sovereignty program, but we're seeing really incredible outcomes there. So I'm really happy to talk more, answer any questions that you all might have, but I'm sure I've gone over on time and I apologize for that. So next slide, I have some contact information if you want to reach out to me, but thank you so much.
Thank you, Cami. Amazing, amazing work that you are doing. Thank you for sharing it. You know, I guess I should have thought of this, but art and storytelling and quilting as family support, amazing, right? Like, of course it is. So thank you so much for bringing your perspective and the wonderful program that you run there to us. I'm sure that we may not have enough time for questions and answers, but I'm assuming you may be getting some email messages from some folks who are on the webinar.
Yeah, please reach out.
Thank you. We're going to move it on to our North Texas folks. We have Miranda Holmes and Leanna Widdick. I hope I'm saying that right, Leanna. And they're going to tell us about their Help Me Grow North Texas journey. So take it away, ladies. Thank you so much.
Yes, thank you so much for having us. And I do have to say that is quite the tough act to follow with those last 2 beautiful, personal, wonderful stories that we've just heard. But we're going to do our best. So today I'm here to tell you about how Help Me Grow North Texas became Help Me Grow North Texas. Specifically our centralized access point, but I want to go back just a little bit and talk about how we became a Help Me Grow site. So our organizing entity, which is My Health, My Resources of Tarrant County, which is where I work, has had early childhood programs for a long, long time. And it really started with our early childhood intervention program. And that program only serves children and their families 0 to 3, and they also have to have a qualifying developmental delay or qualifying disability to be eligible for that program. So we were already seeing gaps in the early childhood services that we were able to provide at our agency. So we started searching out grants across the state and locally to be able to expand those services. And one of those first grants that we received was our HOPES grant. It's a local state grant. It stands for Healthy Outcomes Through Prevention and Early Support. And that grant allowed us to fill some of the gaps by extending our services from the 3rd birthday up until the 6th birthday. And of course, that grant also filled a little bit other gaps by allowing us to serve 0 to 3 kiddos who didn't qualify for those early childhood intervention services. So after we had that for a couple of years, what we saw was there was a huge amount of calls that we were getting for families who needed support and services that we didn't have the capacity to provide. So our chief started thinking, what could we do internally to be a call line and partner with other agencies and services across our area that did probably provide things that we couldn't. That way people could call us but get connected to any of those services. And during one of our early childhood wellness council meetings, someone was there who happened to be a Pritzker fellow. I know y'all have heard a little bit about those today. And she had heard of Help Me Grow through her Pritzker fellowship. And so she said, it sounds like what you're trying to create already exists, and it's called Help Me Grow. So that kind of started the conversation, and our chief got on a plane to Buffalo, New York to the Help Me Grow National Forum that year and learned all about Help Me Grow. And one of the 4 core components of that Help Me Grow model is the centralized access point, which is what it was that we were wanting to create in our area. So that was sometime mid 2019. So in September 2019, we started working directly with Help Me Grow to become an official Help Me Grow site. And the original plans were for us to launch our centralized access point with family navigators trained in child development around August of 2020. But as you all know, March of 2020 happened and the whole world changed. And what we saw was that families were in desperate need more than ever. So we accelerated our launch date and launched our centralized access point in April of 2020 for our Tarrant County families to be able to help them access those very needed resources during the beginning of that COVID pandemic. So that was how it all started. And then since then, we've moved on from just our call center navigation to have some on-site navigation. We do have 2 family resource centers, one that opened in March of 2020 and a second in 2023, that allow us to provide those resources directly to families who walk in to those sites. We have childcare navigation and school navigation, where we have family navigators embedded in the school systems and child cares. And then our newest initiative is geared towards pregnant and perinatal families, and that one's called Healthcare Navigations. And that is where we're working on training staff, case managers, sometimes nurses in hospitals and clinics who are working directly with those families to have full access to our Help Me Grow navigation database and resources, and be able to navigate those families directly while they're working with them without having to send in a referral to us and then the family waiting for us to call, or just giving the family the number and having them call on their own. So it helps us reach more families, and specifically those perinatal families, because we're really trying to improve maternal health outcomes. Next slide, please. So navigation, what it is, I guess I've talked a lot about it. I should explain what it is. It's really the process of guiding families through complex systems to access those necessary services and resources. It involves helping our families identify their needs. We use something called coaching, which we'll talk a little bit more about here in a moment. We complete screeners, help them coordinate services. We can provide education and other trauma-informed psychosocial support and connection. And our family navigators work to reduce barriers related to healthcare, education, social services, and just all of the difficult things that they might encounter trying to navigate the system on their own. And it helps us ensure that families are receiving that comprehensive and coordinated care so that they can gain access to whatever they might need and learn, hopefully, what they might need all in one place. Next slide, please. So we still lovingly call it our child development line, although it is obviously evolved to encompass a lot more things than just child development. But our navigators link families to those community resources and supports based on what their needs are, and using the family's expertise on their own situation to guide them, not being directive. It does include linkage and follow-up, and the follow-up is really the best part because oftentimes families will call and then they may not be satisfied with the resource, or they may have continuing needs. And some of those families are scared to call back or wouldn't call back under normal circumstances. But with our follow-up, that allows us to make sure to call them back, make sure that they're happy with what they received, and if not, continue to help navigate that family to the needed resources. They are all trained in child development and are able to answer child development and now maternal health questions, some maternal health questions. They do developmental screeners as well as screeners for maternal health depression, social determinants of health, opportunities assessment. They do, like I said, all have training on child development. They are also all credentialed as early intervention specialists. And this child development line really helps us enhance customer service because we use trauma-informed navigation. And Leanna is going to talk a little bit more about that as I turn it over to her.
Next slide, please. So at Help Me Grow North Texas, family voice is not just welcomed, it's foundational. We try to be very intentional and have structures and ongoing engagement to ensure that the lived experience of families directly inform how we grow, adapt, and serve our communities. Our Family Advisory Council, which you see some of them there in the picture with their families, is composed of over 10 caregivers from across 18 counties, and those are rural and urban counties, and each of them bring unique perspectives and lived experiences, and these members are empowered to create their own strategic plan to guide system improvements. They review data right along with us, evaluate services, and they provide critical feedback on initiatives. And the council members receive the same training as our staff does. So that enables them to co-lead presentations and educate parents and providers, and their involvement extends very far beyond the council, and they actively participate in community outreach and lead initiatives that reflect their passion and the community's needs. We also complete post-navigation surveys. So that navigation Miranda was just talking about, every family that connects with our centralized access point is invited to complete a post-navigation survey. And with these surveys, we capture this valuable feedback on their experience and highlighting what was most helpful, but also identifying areas for improvement. And then that input is actually reviewed by our centralized access point program manager, the navigators themselves, and the centralized access point subcommittee, which is made up of stakeholders, providers, families across the community. And this really ensures that the family insight is directly influencing our service delivery and giving us that continuous quality improvement. We also created a family story bank. And so this is where we collect and share those real experiences and impacts and outcomes of families and providers who've utilized the supports and services of Help Me Grow North Texas. And these narratives that we've gathered through survey outreach and the information to participate is shared with our stakeholders, partners, partner programs, and families to really accurately illustrate the impact that these services are having on the community. And these stories not only celebrate successes, but they spotlight areas for growth, and they really help to humanize our data and drive this meaningful change. We have participation in our subcommittees and work groups. So as I mentioned, the Family Advisory Council members, they are encouraged to join subcommittees or work groups that align with their interests and their passions. So that might be about the developmental screening or perinatal support or access to school-based services. And then we extend out with flyers and outreach to invite broader community participation, really to ensure that any family is welcome in the community to have a seat at the table and share in shaping our strategic plan, reviewing our data, and co-creating the action items that reflect the real world needs and experiences of those families. And last but not least, at events, our community alignment coordinators gather direct feedback from the families while they're there at the events. So this creates sort of an informal but powerful opportunity to listen and learn to our families. These conversations help us stay grounded in the realities families are facing and ensure our services remain responsive and relevant. Next slide, please. So I wanted to share with you guys Jeremiah and Elijah's story. So when Juanita Gonzalez welcomed her two boys, Jeremiah and Elijah, into the world, it was during one of the most uncertain times. This was right in the middle of the COVID-19 pandemic. Born prematurely due to high blood pressure, the twins faced immediate challenges, and Jeremiah had to stay in the NICU because he couldn't breathe on his own. At home, Juanita was juggling the demands of newborn twins, the stress of the pandemic, and the needs of her family. And as the boys grew, she noticed they were not making eye contact and they were not meeting developmental milestones, and their behaviors were becoming increasingly difficult to manage. Feeling concerned and not sure of what to do next, Juanita reached out to Help Me Grow North Texas. That call changed everything. Through Help Me Grow North Texas Centralized Access Point and Navigation, Juanita was connected to a home visiting program and received a family support coach who recommended the Pathways Parent Education for Mom and the twins. And with this support, she was able to access critical resources. The boys received an autism evaluation and diagnosis, which opened the door to additional services, like a handicap placard to make transportation easier, specialized support from a mental health consultant and speech language pathologist. And the transformation was remarkable. Juanita says she learned how to better understand and meet her son's needs. The boys began to make eye contact, use gestures like pointing, and even started speaking more words. The tantrums became manageable, and Juanita said she could finally take them to the store without fear of a meltdown. One of the twins became fully potty trained, and both were showing incredible signs of progress. And now, fast forward to today, Jeremiah and Elijah are thriving 4-year-olds. They are both potty trained. They can recite their ABCs, identify letters and numbers, and speak in full sentences. They each have individualized action plans through their school district. They're receiving the educational support they need to succeed. And Juanita reflects on her journey with gratitude and clarity. She shared with us, if I hadn't connected with Help Me Grow, I think the behaviors and communication would still be very behind and I wouldn't have understood what they need. She believes deeply in the importance of continuing these services for other families. She said it might be frustrating and disappointing not being able to bond with your child, but that might be a sign to look for help. If this can happen for my family, I believe it can happen for others too. Next slide.
Leanna, that was a beautiful story, and I'm sorry we're going to have to cut you off. We are at time.
Absolutely.
And Ngazi, I don't know about you, but my head is spinning from all of the great information we received today. I do want to just let you know that the webinar today was brought to you by the Prenatal to 3 Capacity Building Hub, which is a project of Build and which is funded through this thing called PCI that you've heard about today, which is the Pritzker Children's Initiative. And we're very grateful to them for allowing us to do that and to be here with you today. You will be getting the recording and the slide deck, and here's the information about the presenters. We have 2 more webinars coming up in September and October, and our annual meeting is coming up in December. We'll be in LA. So please check out that link and check out what's going to be happening at our annual meeting. And one more thing, please fill out the survey. And then Ngazi, I'm going to say goodbye and let you say goodbye.
Thank you all for joining us. We hope that all of the insights that you heard today will inspire and fuel your work moving forward. in the family support space. So thank you and have a wonderful afternoon.